Hello and welcome to vlog number 88. This week, at the request of Health Unlocked user Janvan, I'm going to talk about the Coimbra Protocol. I must confess to not having heard of the Coimbra Protocol before, so I was keen to research it and learn something. So, what is the Coimbra Protocol? Well, the protocol is named after Frizell Coimbra, a neurologist and professor at the Federal University of Sao Paulo in Brazil. Professor Coimbra has created a clinical protocol to treat autoimmune diseases with high doses of vitamin D3, along with a combination of other supplements and dietary changes. Through his research into treatments for ischemic brain damage, he came to believe that vitamin D could be a central therapeutic resource because it stimulates the production of regenerative substances in the brain. In 2001, he began administering doses of 10,000 IU, international units, per day to Parkinson's disease patients. This is a dose that is equivalent to the amount that our bodies produce after being exposed to 20 to 30 minutes of sunshine. Coimbra noticed that one of the patients, who also suffered with vitiligo, an autoimmune disease, had a lesion on his face which had virtually disappeared over a period of just a few months of taking 10,000 IU daily. He found a significant number of published papers that supported an important immunoregulatory role of vitamin D, so he started prescribing vitamin D to multiple sclerosis patients, MS being the most common neurological autoimmune disease, and that became the start of what is now known as the Coimbra Protocol. There is no single version of this protocol because detailed testing of the patient is used to inform the precise doses of the supplements required. In other words, the protocol is tailored to the individual patient. Professor Coimbra has publicly stated that he regards 10,000 IUs per day as the physiological dose of D3 that is safe for any adult to take, and regards the current US recommended daily amount of 800 IUs as a paltry amount. The commonly prescribed dose of D3 on the Coimbra Protocol ranges from 40,000 to 300,000 IUs, the dosage being determined by a panel of tests which include parathyroid hormone testing and monitoring to ensure that toxic doses of vitamin D3 are not administered. This is one of the reasons why the protocol should never be attempted without the supervision of a qualified doctor. As well as vitamin D3, a number of other supplements are included in the protocol, including vitamins B2 and B12, magnesium, omega-3 DHA, zinc, choline, chromium picolinate and boron. Coimbra states that vitamin B2 is involved in many more critical metabolic pathways than is currently recognised, and that an inherited disorder may result in poor intestinal absorption, increased urinary loss and disrupted homeostasis of vitamin B2 metabolites in the central nervous system. He says that such a disorder could affect 10 to 15% of the general population and be the most prevalent genetic risk factor for a number of diseases. It may be particularly relevant for diseases of the central nervous system, including Parkinson's, Alzheimer's, MS and epilepsy, amongst others. Dietary changes are also necessary and include the complete elimination of dairy products and calcium-enriched foods and drinks, and the consumption of at least 2.5 litres of fluids per day to avoid excessive accumulation of calcium in the urine. It is also a requirement to discontinue the use of all nephrotoxic drugs that are toxic to the kidneys, including penicillin and non-steroidal anti-inflammatory drugs such as ibuprofen, amongst others. Professor Coimbra doesn't propose to have found a cure for autoimmune diseases, in particular MS, but several websites that detail his protocol do claim that it is proven to stop progression. There's lots of information available online about this protocol, and it's impossible for me to cram it all into a short vlog, but I hope I've been able to pique your interest, or at least increase awareness. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.